Hi, my name is Barbara Grawl, and I am an Indiana State University RN to BSN student, and this presentation on stroke awareness is for Nursing 444 Community Health Nursing and is my community education project. Learning objectives that will be covered in this presentation include: the learner will be able to understand the definition of what a stroke is. The learner will be able to understand the causes of a stroke. The learner will be able to understand the different types of stroke. The learner will understand who is at risk for a stroke. The learner will understand what the signs and symptoms of stroke are. The learner will understand how stroke is diagnosed and treated. And the learner will understand when to seek emergency help. At this time, please pause the video and take a brief 10-question pretest provided in the link below. Once completed, please resume the video. First, we'll start off with what is a stroke. A stroke is when the brain does not get enough oxygen because an artery becomes either blocked or burst. The brain does not receive the blood needed and starts to die. Causes of a stroke include a blood clot or plaque buildup that blocks the blood flow to the brain, abnormal heart rhythms such as atrial fibrillation, a blocked or damaged blood vessel within the neck or head, and at times the cause of a stroke is unknown. The first type of stroke that we'll talk about are ischemic strokes. You have a transient ischemic attack or mini stroke, which occurs when an artery in the brain gets blocked for a short period of time and the blood flow either slows or stops. The blood flow returns or other pathways open to restore normal blood flow. Ischemic stroke is the most common and is when an artery becomes blocked, and there are two types of ischemic strokes. An hemolytic stroke is when a blood clot or plaque forms within the heart or large vessel leading to the brain and travels to the brain, blocking the blood supply. Thrombolytic stroke occurs when a blood clot forms inside an artery that supplies the brain and stops the blood flow within the brain. Noted to the left is a picture of both to show you what they look like. Hemorrhagic stroke is another type which occurs when a blood vessel within the brain leaks or bursts and goes into or around the brain. There are three types of hemorrhagic strokes. Intracerebral hemorrhage is caused when the vessel bleeds into the brain tissue. The bleeding causes the cells to die and the affected part of the brain stops working. Subarachnoid hemorrhage occurs when the vessel bursts near the surface and leaks into the space between the brain and the skull. An aneurysm occurs when a weakened vessel bulges and bursts. When it bursts, it leaks around into the brain tissue. The population at risk for a stroke include those with hypertension, high cholesterol, diabetes, heart disease, African American, Native American, Hispanic, or Alaskan Native descent, being over the age of 60. Women are at a greater risk than men. There are some modifiable risks that also put you at risk for developing a stroke, and they include obesity, smoking, taking birth control, which is increased when you smoke and take birth control, physical inactivity, increased alcohol use, and use of cocaine and methamphetamine. Signs and symptoms of a stroke include weakness or numbness of the face, arm, leg that occurs on one side of the body, trouble walking or moving an extremity, loss of balance or coordination, increased confusion, slurred speech, trouble speaking or understanding speech, vision changes that can include blurred, double, or loss of vision in one or both eyes, dizziness, nausea or vomiting, and a severe headache that is often described as the worst pain ever felt. The diagnosis and treatment of a stroke include the following. For diagnosis, usually through physical exam with medical history and your symptoms, a CAT scan of the brain, magnetic resonance imaging of the brain, CT angiogram, which uses a computer to take x-rays as dye is injected to view the blood vessels, an MRI angiogram to evaluate the blood vessels. Cerebral angiogram uses x-rays and dye to view vessels of the brain and neck. Treatment of a stroke depends on the type of the stroke, the duration, severity, and the cause of the stroke. Treatment must begin early, and most treatments need to begin within 3 to 6 hours from the last well-known time. Initial treatment includes aspirin, medications to control blood pressure, anticoagulants or antiplatelets, and procedures to increase blood flow. Endovascular procedures, where a long tube is inserted into a large vessel in the leg or arm to install a device to repair the damage and prevent further leaking. And at times, surgical intervention for hemorrhagic stroke includes placing a metal clip at the source of the bleeding to stop blood loss. When is it important to seek emergency treatment for someone? According to the CDC and the American Stroke Association, you can use the acronym BFAST. B stands for balance. Does the person have sudden loss of balance or coordination? E stands for eyes. Is the person having double vision, or are they unable to see out of one eye? F stands for face. Ask the person to smile. Does one side of the face droop? A is for arms. Ask the person to raise both arms. Does one arm tend to drift downward as they try to hold it up? S is for speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or different? And T is for time. If you see any of these signs, call 911 immediately. The sooner they get treatment, the better their outcomes can be. At this time, please pause the video and take a post-test provided in the link below. Once completed, please resume the video to see additional resources and references. Additional resources for continued education include American Heart Association. Carroll Hospital Center has a stroke support group for living after a stroke, Centers for Disease Control and Prevention, and the National Stroke Association. References used in this presentation include American Stroke Association, Centers for Disease Control and Prevention, and Excelsior Interactive Patient Education. Thank you for watching, and I hope you found this presentation educational.